Hello everyone, good day. I am Dr. Sean, a resident ophthalmologist in Petri Medical Hospital, and today we will discuss optic neuropathy. So optic neuropathy is a damage in the optic nerve involving changes to blood flow, harm to structures in the eye, and other underlying causes. When you say optic nerve, it is a nerve at the back of the eye that carries visual information to the brain. There are different types of optic neuropathy, and one of those is ischemic optic neuropathy. Under ischemic optic neuropathy is divided into two, the anterior and posterior ischemic optic neuropathy. So now let's discuss anterior ischemic optic neuropathy. When you say anterior, it is the loss of vision due to interruption of blood flow to the anterior part of optic nerve, also known as optic nerve head. There are two types of anterior ischemic optic neuropathy, the non-arteritic and arteritic ischemic optic neuropathy. So I have here a scenario in a clinic to understand more the types of anterior ischemic optic neuropathy.
Hello, Doc. May I ask what is non-arteritic ischemic optic neuropathy?
This is the most common form of condition that refers to loss of blood flow to the optic nerve. This condition affects mostly over the age of 50. However, this can occur at any age. Both men and women have the same rates of occurrence.
What are the risk factors?
There are many risk factors such as smoking, vasculitis, sleep apnea, hypertension, optic disc drusen, and diabetes mellitus.
How can someone have this condition?
This can be caused by one of these. It can be because the drop of blood of pressure, increased pressure inside the eye. It can be due to narrowed arteries where interruption of blood flow may occur, increased blood viscosity thickness, and lastly, it can be due to decreased blood flow to the optic nerve. There are many possible causes of this condition. That is why it is very important to have thorough examination.
Then how will I know if I already have this?
Well, there are signs and symptoms that should be observed. On top of that, sudden, painless monocular deterioration of vision usually occurs on waking in the morning or even from a nap. A central vision loss can be observed as well as inferior nasal defect. Patient may be sensitive to light and glare, and also a relative afferent pupillary defect.
Are they going blind?
Possible, but not eventually. And also, there will be restrictions in the vision. So when this happens, the person will have a hard time to move independently. He may be needing some assistance when moving from one place to another. Some of his daily activities will not be possible anymore, such as driving, but can still go to grocery only when being accompanied. Reading will also be impossible to patient when his central vision is affected. Since there is inferior nasal defect, climbing down the stairs would be challenging. As what I have said, there will be limitations in the activities of the patient, but we can still make use of the remaining vision that was left.
That would be so difficult to deal with.
Yes, I know, that would be very difficult. That is why we encourage our patients to have counseling when being diagnosed with this condition. We need to make sure that patient can handle the situation and guide them all the way.
But how about treatments? Are there available treatments for this?
Unfortunately, there are no treatments for this that are proven to be effective, but reducing the risk, including healthy diet, regular exercise, and treat the risk of diabetes, high blood pressure, and sleep apnea can help.
Wow, I learned a lot. Thank you for sharing that with me, Doc.
You are most welcome. I'm glad you learned something. Well, I think it's time, so I have to go now. See you around.
Bye, Doctor. So that was non Arteritic ischemic optic neuropathy. Hope you learned something too. Good day, doctor. I was diagnosed by my other doctor with arteritic ischemic optic neuropathy, but I did not understand what he is saying. Can you tell me what is that?
Okay, so arteritic ischemic optic neuropathy is a dangerous condition caused by inflammation of arteries supplying blood to the optic nerve. This inflammation is due to a condition known as giant cell arteritis. This affects 3 times more often in women than men, and most often affects those over the age of 55.
What are the risk factors of these conditions?
We do have systemic risk factors, and that includes giant cell arteritis, polyarteritis nodosa, Wegener syndrome, and rheumatoid arthritis.
What caused this condition?
This is caused by inflammation of arteries supplying blood to the optic nerve.
How come this happened to me? I only experienced temporary blur.
Yes, temporary blur is one of the symptoms of this condition. A painless, temporary blurriness or loss of vision lasting several minutes to hours before vision loss becomes permanent. Based on the examination, other symptoms are observed such as scalp pain or tingling, pain when chewing, and also pain in the temples. All these are symptoms of giant cell arteritis. Aside from those I have mentioned earlier, there are also other manifestations that can be seen on the patients, and that includes transient blurring or loss of vision that precedes with permanent vision loss, headache, neck pain, anemia, temple pain, weight loss, achy joints, and general fatigue.
Am I going blind?
Sooner or later, you will lose your vision, especially if no treatment is taken for your giant cell arteritis. You can have restricted vision. A central loss or diffuse field loss are possible to occur. You can still do things that you're doing before, but only in limited range. It would be difficult for you to read a magazine or books, and you can move independently, but due to your age, it is better to have someone to assist you in order to refrain from bumping into objects.
Do we have any treatment for this?
The actual management for this is actually the management of your giant cell arteritis, but we can still have steroid therapy to prevent visual loss since your condition is still developing. So that's all for today. Please come back next month for your follow-up checkup, and also, if something bothers you, you can visit me anytime, okay?
Okay, doc. Thank you so much.
And that was the difference between non-arteritic and arteritic ischemic optic neuropathy. And lastly, we have here a different set of tests in order to diagnose. First of all is the visual acuity. We have to check if there is decrease in the vision of patient or how severe its deterioration. Next is visual field to gauge any central or peripheral visual loss or scotoma. Measurement of pressure within the eye or the intraocular pressure should also be checked. A dilated eye exam is done to detect any damage to the optic nerve. Fluorescein angiography is done by injecting dye into arteries to determine if there are any interruptions in the blood vessels. Measurement of overall blood pressure should also be checked. And lastly is other blood work to detect conditions such as diabetes, vascular disease, anemia, or high cholesterol, which are also considered a risk factors. And that is optic neuropathy. So I'm going to end my discussion here. I hope you learned something and thank you for listening. Have a nice day.
What is optic neuritis? Optic neuritis is a condition that affects the eye and your vision. It occurs when your optic nerve is inflamed, and this is the location of your optic nerve. And what is optic nerve? The optic nerve carries visual information from your eye to your brain. And what happens if you develop optic neuritis? Well, the optic nerve is irritated and inflamed. It doesn't carry messages to your brain as well, and you can see clearly. What is cause of optic neuritis? The exact cause of optic neuritis is unknown. It is believed to develop when the immune system mistakenly targets the substance covering your optic nerve, resulting in inflammation and damage to the myelin. The following autoimmune conditions are often associated with optic neuritis. The first one is the multiple sclerosis. And the second one is the neuromyelitis optica and the myelin oligodendrocyte glycoprotein, or the MOG antibody disorder. And other associated causes need to be considered, including infection. Bacterial infection including Lyme disease, cat scratch, fever, and syphilis, or viruses such as measles, mumps, and herpes can cause optic neuritis. And other diseases such as sarcoidosis, Behçet's disease, and lupus can cause recurrent optic neuritis. And the last one is drug and toxin. Some drugs and toxin have been associated with the development of optic neuritis. Ethambutol, used to treat tuberculosis, and methanol are common ingredients in antifreeze. Paint and solvents are associated with the optic neuritis. Symptoms of optic neuritis. Pain. Most people who develop optic neuritis have eye pain that worsen by eye movements. Sometimes the pain feels like a dull ache behind the eye. Vision loss in one eye. Most people have at least some temporary reduction in vision, but the extent of loss varies. Noticeable vision loss usually develops over hours or days and improves over several weeks to months. Vision loss is permanent in some people. The visual field loss. Side vision loss can occur in any pattern, such as central vision or peripheral vision loss. Loss of color vision. Optic neuritis often affects color perception. You might notice that color appears less vivid than normal. Factor to develop optic neuritis. First is the age. Optic neuritis most often affect adults ages 20 to 40 years old. Sex. Women are much likely to develop optic neuritis than men. And race. Optic neuritis occurs more often in white people. And the last one is genetic mutation. A certain genetic mutation might increase your risk of developing optic neuritis or multiple sclerosis. Complications arising from optic neuritis may include optic nerve damage. Most people have some permanent optic nerve damage after an episode of optic neuritis, but the damage might not cause permanent symptoms. Decreased visual acuity. Most people regain normal or near vision within several months, but a partial loss of color discrimination might persist. For some people, vision loss persists. And side effect of treatment. Steroid medication used to treat optic neuritis subdue your immune system, which causes your body to become more susceptible to infection. Other side effects include mood changes and weight gain. And the management of the optic neuritis. Well, the optic neuritis usually improves on its own. Typically, it heals on its own, and steroid medication are used to reduce inflammation in optic neuritis.